Hi everyone, welcome back to Warrior Beauty. We wanted to give you an update on what's going on lately or what's gone on. We recently went to MD Anderson in Houston. If you saw my previous video about going back for the brain MRI after 3 months after my gamma, we were faced with not having any options here except to get into a clinical trial in MD Anderson and put in the Omaya port, which I did, and that video talks about that. So actually I'll take this as Dolly, my wig. But the Omaya healed into there. Hasn't been used yet. And everything's healing really well. I've done 3 whole brain radiations and
you can't even see the scar has healed so well. That's really, really good. There was 4 staples here, and then this is the Omaya, and even so, you can barely see it's visible with the bump.
So people in Texas were surprised because they said people in California do this low profile
subcutaneous Omaya port, whereas in Houston they do it exposed. So you have a little plastic bubble that's stuck to your head like a
it's like raised up or something. And here they like burrow into your actual scalp bone and then set it in deeper. So we had no idea until the doctor examined my head that was even a thing. Nobody told us that, but I mean, hey, I'm thankful.
It's kind of cool. Yeah. You're going to have it the rest of your life. Might as well have.
And you could still tell where it is to find it, to access it. So.
It's hardly noticeable unless you know what you're looking for.
Yeah.
Traveling was an adventure. We got 2 planes there with a layover in Denver. The layover wasn't bad. A 2-hour flight from here to Denver. Probably about an hour layover, which just gave us enough time to get coffee, grab a bite to eat, and then
get on that crazy train. We'd never been to Denver.
The airport's huge, so you have to
take it once, but I don't remember it looking like that.
You have to take a shuttle because we were going from Terminal B to Terminal C, and then we made it to Houston. It's a 2-hour flight to Denver, and then from Denver to Houston, another 2-hour flight. We got in at midnight. They lost my luggage, so I didn't have a bag, and they didn't tell me initially they lost my luggage. They told me initially it was stolen. So I had to go back the next morning and literally take a lift. I didn't sleep all night because I had to go back at 6 a.m. We didn't get to the hotel till close to 1 a.m. So I was like, what's the point? I couldn't sleep anyways because I was stressed about the trip and about losing the luggage. So then I took a lift back to the airport, which is a good 30-40 minute drive. Got there, filed a baggage claim, filed a police report because they told me it was stolen. And then the day before we were ready to leave, they called me and said, oh, we found your luggage, it was mistagged. So they had lost it the whole time.
And backstory, by the way, taking care of your caregiver, Mr. ended up in the hospital for 4 days right before my Omaya was placed in. So he had medication that he needed too, not just clothes and his toothbrush and all, but medication that he seriously needed to be on to help.
Put it on your onboard. Yeah. Your carry-on luggage.
That was United, right? United. They're like, don't ever do that. Make it, carry it on with you. Like how we don't fly. We haven't been blessed with the traveling,
flight specialist
thing. Yeah, like we
knew not to take liquid, and even then we had a couple of buy drinks that we had to toss out, and some
Bath and Body Works. I was gonna check both bags and we only checked one, and then they took my brand new Bath and Body Works and just like checked it. I was even begging the guy, please just take it home to your wife. It's brand new, please. No, somebody took it out of there. Come on.
And I still have swollen area right here from a fall that I had while I was in the hospital. I was dehydrated. I had a GI bleed that they never found from stress, and then they gave me Ambien while I was dehydrated, hadn't eaten in 24 hours, and he got up to go to the bathroom and blacked out, and the IV stand, the middle IV stand, came and fell and hit me right across the eye. So I think it actually cracked my eye orbital. But
you could have died like twice.
Anyways,
all the way to needing an infusion. And
that's not the point of this.
He could have died twice.
Just a little note to the caregivers. I didn't do anything to cause this. It was just stress.
We didn't do anything that causes this. It's just life.
But take care of yourself, caregivers, because you're no good. I added more stress to our already stressful situation by getting hospitalized for 4 days, with them running a slew of tests on me, all finding nothing. So thank goodness the GI bleed stopped wherever it was located, because they never located it, and my symptoms have slowly subsided. But just a caveat, a note of importance to you caregivers for your loved ones with cancer: take care of yourself, because if you end up in the hospital or you end up stressed to the point where you're,
I don't even know how to, because everybody always is like,
I didn't do anything wrong. I've been eating good. I've been trying to sleep. Even went to the doctor to get like antidepressant medication to help me sleep. I mean, I'm literally trying to do everything, eating healthy.
We totally went plant-based for,
so, I mean,
and then boom,
it just
he was in the,
happened.
I don't know. I don't even know the answer to how to help that. We have some very, very, very close people to us that said we should have more support around us all the time, but sometimes it's hard that for us to even know what that means or what we need, or when we're getting it and we're talking to those people and they're hugging and loving on us, you're like, oh my god, this is exactly, just sitting around in our jammies. But do we want everyone in the world sitting around in our jammies every day? Like, no, but
we're still capable. Both you and I, you need rest, and I'm fully capable of
but
cooking,
when you're
cleaning,
constantly cooking, and I clean when I can and cook some, but he's taken on a huge part of, doing way more in the house and working full time or being with me full time, falling on my face.
Anyways, back to the trip to MD Anderson. It was stressful, the traveling part of it, but I mean, not bad. The flights were smooth. We got there on time. We didn't miss any flights. The lost the luggage thing was a disaster, a mess, because then, I don't know. They weren't very friendly when I went to go talk to them about compensating me for having to buy new clothes or whatever.
We had to go buy all new clothes, like literally everything.
So I just bought a few things to get me through and was wearing the same thing over and over again, but oh well.
So now we both have backpacks, bigger backpacks, and a carry-on, and that's all we're doing.
No check luggage.
Not checking
Forget it.
Anything.
Just carry it all on.
UPS it back and forth or something.
Yeah. So anyways, that was the traveling, but then when we got to Houston and actually did go to MD Anderson, it was amazing. Just amazing. So
we met a lot of incredible people, like all along the way.
Everybody in Houston was friendly, but the hospital itself, it's a city. It's its own city. It's like a downtown metropolis of high-rises, 21 specialty hospitals, all located on this one campus. And the MD Anderson Cancer Center that we went to was on the 9th floor. The entire 9th floor is dedicated to melanoma. And I mean, we've never seen that before.
Normally melanoma is like the
little red-headed stepchild of cancer.
Even with the dermatologist, you go in and they're like, get your chin done and your Botox and your this and that. And if you have skin cancer, go sit in those 2 seats right there.
So that was pretty incredible to see an entire floor dedicated to melanoma specialists, and that's everybody who works there is just, their goal is to eradicate melanoma cancer. And speaking of the eliminating cancer in general, their entire slogan for the entire hospital system, all 21 hospitals, every employee, every sign, anytime you see any kind of MD Anderson logo anywhere, the cancer on it is marked out in red. I just thought that was so cool. So I mean, like even the kitchen staff in the cafeteria, they have MD Anderson Cancer Center, and the cancer is lined out in red because their goal in that entire facilities to eradicate cancer and to heal patients. Again, I've never seen that before. I thought that was a really, really cool, neat touch. In fact, I bought Christina a t-shirt from the gift shop because I liked it so much. Thought it was cool.
It's awesome that they do that. So you're reminded like every turn that they're eradicating cancer like wherever they can. And we met with Dr. Glitza and her team, and they're incredible. Like I didn't expect, I was sitting there just praying like, can I even get into this clinical trial? Like I thought we had one option and that's it. Like, and then she came at us with an entire marker board full of, this is what we can do, this is what I think we should do, which ones do you want to do? And we were like, I'm all for all of it. Throw like the whole kitchen sink at this damn thing.
The first day we were there, it was 5 hours of labs and meetings, and it was a lot. It was a lot of information, but it was all necessary. Her medical intern assistant came in and met with us for about an hour to talk about where we've been, our journey to this point. He went over everything. No detail was too small, nothing was unimportant. He literally went over every doctor, every exam, every surgery, every scan. I mean, everything, our complete history up to that point, so that they can get caught up and up to date on where she is. Then he met with Dr. Glitza, the melanoma specialist who's in charge of the clinical trial, and they conferred for about 30 minutes while we waited, and he went over it all with her. Then they both came back in and went over the game plan. That's when she got on the whiteboard and literally wrote it all out for us. Here's all your options, here's all your treatment options, here's what works, here's what doesn't work, here's what will buy you time, here's what the treatment that is standard of care, and here's what the clinical trial entails, and here's what I think your game plan should be. And she literally mapped it all out for us on a giant whiteboard. And it was kind of cool because I was able to take a picture of it because there's a lot of information. So I was able to capture that in a screenshot of the board and know exactly where we're at and what we're doing. And it was just, it was so detailed and so incredible. And
I didn't think she would have like a plan
that
other
fast.
than, or I thought she was just going to do the intrathecal and that was it. Like, and she came in and said, I think we should start here, and you're not going to like this, but she thought we should start with, she said I wasn't going to like it, that we should start with whole brain radiation. And I had been told here, we'd always been told from the very beginning that we had to leave whole brain for the last resort because it was going to like take me away. I wasn't going to be myself. And so that's horrifying, and she was starting to explain that, no, you just get short-term memory loss where, you walk in a room and you're like, what was I? Oh, my glasses, or, it might happen a little more often once my whole brain is done, but it's not. And, there are scary, crazy side effects that can happen in everything, including this. But because my lesions are very small, that makes the chance of it happening even less. Like if I had bigger tumors, that's what they're saying. So as up till now, I've just been tired after radiation and nauseated at times.
We've had 3 rounds of treatment so far. It's today's Black Friday, so we had Monday, Tuesday, Wednesday. They gave us Turkey Day and today off, and then we go tomorrow. And then we'll go all next week, Monday through Friday, and then have a 2-day break again on Saturday, Sunday, and then the last 10th round of whole brain radiation treatment will be next Monday. And the way she described it to us and the way she explained it was that the whole brain radiation is going to weaken all of the cancer cells in her brain as well as the cerebral spinal fluid, so that when we do start the immunotherapy treatments intrathecally through her myoport into her brain and her cerebral spinal fluid, it will attack those weakened cancer cells that have been affected by the radiation. So it's kind of a prep for the medicine to come. It's to get those cancer cells weak and to allow the immunotherapy to penetrate deeper and kill them. And the whole goal of having her, she's going to have to do IL-2 as well, which is, I'll let her explain that right now, but that's another form of immunotherapy that will flood her brain and her cerebrospinal fluid with white blood cells that her own immune system will help kill the cancer and the lesions that are in her brain.
IL-2 was the original immunotherapy for melanoma, she said. It basically gives you drug-induced meningitis. So most people go in for a whole month of it. At first she was thinking I would need 2 weeks, and now they put it to 1 week. You're hospitalized that whole week. And most patients don't really remember the week. She said it's even super hard on the caregivers to see the patient the way they are. We're on the drug, and then we're given painkillers because it's very, very painful. And
sedatives
basically
and
just
both.
I'll be out, not able to communicate
like
much.
It's almost like a drug-induced coma.
I guess
because it's
that part sounds scarier, honestly, than the whole brain. But I mean, I'm willing to do whatever it takes to throw at this thing. If that will, they were saying something about normally running around in everyone's brain and spinal fluid, you may have like 15 per 1,000. Is that what it is?
15 per 100 or something like that.
15 per 100.
White
blood cells, white to red. But if you do this IL-2, it will have what, 200?
No, it's like 45 to 100.
Oh, okay. Anyways,
so it triples the amount of white blood cells you have in your.
And that helps. And then when they give me the IL-2, which was like, all right, soldiers kill, it like sounds the charge, then there'll be more up there to go in and do what they're supposed to do. So
but if you Google or look up the symptoms for spinal meningitis, it's all bad. It's terrible. So
I don't even look at the symptoms, to be honest with you.
Thus the
I don't
sedatives and the painkillers and the so that's going to be a rough week. And then after that, she gets a little bit of a rest, and then we'll start the intrathecal.
Yeah, I might be able to come home, or we might be able to come home
for a
Christmas
week
and my birthday, maybe. And
to give her a break in between, and then the insurance still has to approve the trial entry. So that's a hurdle.
We still haven't heard on that either. So if you're praying for us, please continue to pray, because we need that insurance approval to even do this.
Get into the clinical trial.
If we don't, then we have to
Appeal
petition and fight and try to do the right to try and all that madness. And I don't know how much time I would have to get all that done.
Well, luckily the whole brain radiation and the IL-2 is considered standard of care, so the insurance cannot deny those. And that's kind of why Dr. Glitza wanted to build up to the clinical trial by using those, because if we do have any kind of hiccups with the insurance, that still buys us time and gives her some healing up in there, some medicine up in there. And then we also have the option of doing chemotherapy intrathecally to buy more time if we need it. Typically, chemotherapy has not worked well on melanoma, and it's just literally just buys you time.
She said she would even revisit the Opdivo your boy, because sometimes throwing your boy at it again works, which that put me in the hospital last time too. Like I said, whatever we have to do, I'm up for it.
There was another combination of targeted too.
Braftovi, Mectovi to change it. So there's still
shock the body.
Yeah, there's things in her bag.
Yeah,
tricks.
Her toolbox still.
But to even have hope is amazing. There's nothing here in California at all. They just looked at us like
clinical trial wise.
Yeah.
There's nothing.
Well, even normal without
they can do
clinical trial, they couldn't do much.
Braftovi here, and they can do the IL-2 here.
No, they can't. They had to do that one in Houston.
And they can do the whole brain here, thankfully.
Yeah. But I mean, like, as far as
that is a real blessing that Clovis community, which is just down the street from us, was able to do the whole brain, because that's 2 weeks of us being able to be home.
And to have to do it every single day is like.
Yeah,
but
that would have been hard to do in Houston. Yeah.
And the Lord's just been placing people in our path like crazy. Like, I don't know of any other time in my life. I mean, there's times that I can clearly see the Lord's hand in things, but I've never seen like a map being drawn and like literally like paving stones like being like, here's the footsteps, here's where we're going, this is what we're doing, and we're like, you know, like, seriously, like, that's what it feels like.
Yeah.
Like one of those things in a movie you see where like footsteps just are like lighting up, and we ran into on Facebook on the support groups. I have a friend named Brenda that she actually, I didn't even know this till this week, works for AIM at Melanoma, which is amazing. And she lives in Texas in a little town north of Houston, and was telling me how wonderful it is. And then she got us in touch with Kaylee, who is a realtor there, and of course my best friend is a realtor here, and then Kaylee's brother-in-law owns a moving company, and so I mean they're just gonna see like what, you know, so it's just insane. Like, you know, if we ever had to go sell and move and do, you know, whatever, like that's all in place too, you know, just sitting there, and that's pretty amazing. I don't know if that's ever happened before either, except for Lindsay helping over here. But
yeah, so I mean, the Lord's really answering prayers and blessing us in a lot of different ways.
yeah.
So there's no complaints here.
And the GoFundMe, we haven't talked about that on here.
No, and yeah, that's been just super amazing because of the cost of the hotel. Because it happened so fast, none of the cancer groups were able to help us with the travel expenses this time. They will be helping us in the future, but this time it was just, we had to get up and go and book flights, book hotels, get transportation to and from the airport, and it was very, very expensive. And the GoFundMe, your love, your generosity, your kindness, your giving to us was the only way we were able to afford that. So thank you to everyone who's given to us through the GoFundMe. That's been a huge help, amazing.
Incredible
I mean,
love,
just
outpoured all over us.
It's a blessing like we can't even tell you, and you guys are just amazing. And thank you. We thank God for you. We thank you for your generosity and kindness. I just got my doctor bill from this day, and I was kind of freaking out about it because it was $2,500. So I'm gonna be calling them and talking to the insurance and seeing what I can do to make sure that's accurate. And I don't know, it's just another stress that we don't need. But
we didn't want to have to do the GoFundMe. We had talked about it before because it's really been a struggle this entire time. I mean, thankfully we've been okay, and but it's been really hard. But we kept saying we don't want to do a GoFundMe. We don't want to ever have to ask anybody for anything. Like, that's just not who we are. But at this point, it just again became apparent. Like, you have to ask for help. Like, at this point,
we're both prideful people. I mean, and fiercely independent. So it was hard. But with the traveling that we were faced with, there was just no way.
And when it comes down to your life, when Dr. Dowd was like, "Can you get to Houston? Can you stay in Houston? Can you?" I'm like, "It's my life. You tell me what I need to do, where I need to be, and I'll be there tomorrow. I'll make it happen." So, and you guys helped us make that happen. You guys are the reason that we were able to get there. So thank you so much.
Thank God. Thank you. We're grateful for you. You guys are like angels to us. We appreciate it.
So that's where we're at.
Yep.
Hopefully we'll have another update and more Christmas wonderfulness to share with you next time.
Maybe a different wig, because we've had some wig adventures.
I didn't even post the first two. They were so bad, and that one's alright.
And I was disappointed because I had some really, really good commentary in the background, like peanut gallery type commentary about those wigs.
I still have it if you want me to. I could add it at the end.
I think this looks better than all the wigs, but
Dolly?
that's just no, Dolly.
I think it's Dolly. You said it was Chrissy, but
Chrissy from Three's Company.
But people already call me Chrissy sometimes. Well, what would be Dolly be then? It would have to be like
her hair's all white and curly, isn't it?
I guess. But if I'm gonna go white, I'll be more like.
Come and knock on my door. Oh, it's Mr. Furley's gonna knock anytime now and want the rent from us.
This one at least can go. It can go middle part. It can
all
be
right, I think. Yeah. Okay, time to go.
Right.
That thing, I know what's gonna happen. I'm gonna wake up one night and it's gonna be attacking me. It's gonna be just on the bed, like crawling towards me. Shots fired. All right.
So ridiculous. Bye, you guys. If you want to keep with us on this journey, click subscribe and
subscribe is right.
And the bell.
See it right there, the bell. It's right there. Look it right there. All right.
All right. Bye.